Adalimumab, also known as Cyltezo, is used to reduce pain and swelling in certain types of arthritis and to treat certain skin disorders. It works by blocking a protein called tumor necrosis factor, or TNF, in the body's immune system. This can help reduce joint swelling, prevent joint damage, and preserve joint function. In addition to arthritis and skin disorders, adalimumab is also used to treat certain bowel conditions such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. The recommended dosage and timing for adalimumab may vary based on individual circumstances, so it's important to follow your healthcare provider's instructions. Before starting Cyltezo, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional and the product package. Before using Cyltezo, check the product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use Cyltezo exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment, and in children, the dosage is also based on weight. Your doctor may prescribe a different schedule or higher dose at the start of your treatment for certain conditions, so carefully follow your doctor's directions for using this medication. Make sure to store and discard medical supplies safely. Use Cyltezo regularly to get the most benefit from it, and mark the day on the calendar when you need to receive this medication to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. Some common side effects of Cyltezo may include redness, itching, pain, or swelling at the injection site. However, if you notice signs of infection such as a persistent sore throat, cough, fever, or trouble breathing, it's important to notify your doctor right away. Serious side effects can include symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising/bleeding, numbness or tingling, and vision changes. Additionally, Cyltezo may rarely cause liver disease or a serious allergic reaction. If you experience any of these serious side effects, seek medical help promptly. This is not a complete list of possible side effects, so if you notice anything unusual, it's best to contact your doctor for advice. This medication may weaken your body's ability to fight infections, which can be very serious and even fatal. It's important to inform your doctor about any past, recent, or current infections, as well as any travel to or residence in areas where certain fungal infections or tuberculosis are common. Your doctor will also test you for tuberculosis before and during treatment with Cyltezo. If you develop signs of infection, notify your doctor immediately. There is a small risk, especially in children, teens, and young adults, of developing cancer due to this medication or your medical condition. It's important to discuss the potential risks and benefits of treatment with your doctor. Watch out for symptoms such as persistent fever, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats, and inform your doctor if you experience any of these. Before using Cyltezo, make sure to inform your doctor or pharmacist about any allergies you may have or if you have a history of infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Cyltezo can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with people who have infections that can easily spread, such as chickenpox, COVID-19, measles, or the flu. Inform your healthcare professional before getting any immunizations or vaccinations, and avoid contact with people who have recently received live vaccines. To lower your risk of getting cut, bruised, or injured, be cautious with sharp objects like razors and nail cutters, and avoid activities such as contact sports. If you're planning to have surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for infections and cancer while using Cyltezo. If you are pregnant, Cyltezo should only be used when clearly needed, so discuss the risks and benefits with your doctor. Cyltezo passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions, as they can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cyltezo, cf. Pen Crohn-Ulc Colitis-Hid Sup Strt 40 mg per 0.8 ml Subcut kit. Inflammatory bowel agents include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Always consult with your healthcare provider if you have any concerns about potential drug interactions. Remember to follow your doctor's instructions carefully for the best results. If someone takes too much Cyltezo and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It's important not to share this medication with others. Your doctor may also recommend lab or medical tests, such as a complete blood count or liver function tests, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, make sure to consult your doctor or pharmacist for instructions on when to take the missed dose. Do not take an extra dose to make up for the missed one. Make sure to store Cyltezo in the refrigerator, but do not freeze it. Some brands of this medication can also be stored at room temperature, so check with your pharmacist or read the product package for more information. Once the medication has been stored at room temperature, do not put it back in the refrigerator. Keep the medication in the original container to protect it from light, and be sure to discard any unused portion of the medication. Keep all medications away from children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard Cyltezo when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.